To have you back. Now, the Western Cape Health Department wants to vaccinate over 5 million people against COVID-19 by October this year. And the province will only administer the Pfizer vaccine. This due to delays in dispatching the Johnson & Johnson vaccine. So to find out more about how the preparations are actually going, let's speak to the head of department. That's Dr. Cloete, who joins us now from Cape Town. Dr. Cloete, thank you so much for your time. Good morning to you. 5 million is your target by October, but if reports are anything to go by, it seems less than a quarter of senior citizens in the Western Cape have actually registered to be vaccinated. Are you not concerned?
Good morning, and good morning to the viewers. Yes, we are concerned, and we're going on an extra drive to encourage people to be registered on the system. As of yesterday, there's 191,000 people that have registered. We have over 700,000 people in this province. So we want to increase the numbers quite significantly over the coming weeks.
Yeah, what's the reason behind the slow pace in registration from our senior citizens in that part of the country, do you think?
Well, there's a few reasons. I mean, firstly, it's really about people being aware to be able to register. Then, secondly, being by means to be able to do it. It is an electronic registration, so many people do not have access to the electronic means that you require to be able to do it. So we are working on both of those, and we are now encouraging young people, everybody, to assist somebody over the age of 60. And it's also been access to internet. So now there's also a WhatsApp link. There's also just a toll-free number link in terms of the USSD system. So it's really to enable all of us to go out in a targeted way to find the people over the age of 60 to be able to ask them to be registered on the system.
Right. So, Doc, I also understand that besides, obviously, the electronic vaccination, system being for, obviously, the vaccine rollout, it's also to actually match the appointments made by those registered to the actual stock. So it's quite important to have that data being accurate.
Yes, so what we have and agreed with our national colleagues is we have now access to the individual person data on the system. That gives us in the province the ability to be able to see where the people are, to link them to specific sites, and to make sure that this runs as smoothly as possible. So we are putting the sites in place, and we're also putting all our logistics in place. And with all the registered numbers, names and numbers and addresses on the system, we now can start doing that matching process. We will start on the 17th, primarily firstly reaching out to old age homes, but also providing some access to people over the age of 60 at our designated sites. And therefore, we are starting reconciling that process so that we can start having the first people vaccinated next Monday. We also expect that once the vaccination starts, which has happened everywhere in the world and also happened with the healthcare workers, once vaccination starts, the interest for registration will also start picking up. Yeah. And therefore, we will also be looking at an increase in registration once vaccination starts next Monday.
So, Doc, with that plan being in process and, of course, being in progress in the Western Cape, are you of the opinion that we should implement a hard lockdown? It seems experts are further warning of, the risk of a third wave in the country.
The third wave is real. It has been registered in at least 2 or 3 provinces already. We in the Western Cape are also starting to see an upswing in cases. So it does put the people that we're specifically targeting at risk themselves, because people over the age of 60 is more at risk of severe disease and illness. So our preferred method here is that people observe the behaviors, because we can control the spread of COVID through the behaviors by not having into crowds, having social distancing, wearing the mask, not traveling to areas of high risk, and putting others at risk. That's a preferred position, but obviously the country and the National Department, the National Control Council will make decisions about the movement and the lockdown levels.
All right, I'll need to let you go in just a moment, but before I do, just some clarity here and an update on the administration of the Pfizer vaccine. I understand that will be the vaccine that you're administering, especially after the halting there of the Johnson & Johnson vaccine.
Yes, so just to clarify for everyone, we will be getting a consignment of Pfizer vaccine, 34,000, and that is on the 14th, and that is this Friday. But we're getting 34,000 every week thereafter, the 21st and the 28th. And on the 28th, we also get 260,000 Johnson & Johnson vaccine. So it is weekly delivery of 34,000, 34,000, 34,000, and in the third week, the 28th, we get 260 Johnson & Johnson. So we will start off the first 2 weeks with Pfizer, but by the third week, there will be significant amounts of Johnson & Johnson added to the system.